Okay, so welcome to another live Facebook webinar podcast. I'm not quite sure what to call these, Denise. We've got to come up with a better name. Hosted by PALCUS. My name is Angela Simoes, and I'm here with Denise Borges. How's it going, Denise?
I'm fantastically well now that I'm here with the most amazing chairperson of any Portuguese American organization in the universe.
Right.
And with the amazing Dr.
Yes,
Amaral.
Dr.
I mean,
Amaral,
what else could you ask for on a Thursday evening? I mean, this is a blessing. You know, this is paradise. There's no better place, not even in Portugal.
Right.
Well, I got to tell you, Denise, I got to tell you, your background makes you look like you're in paradise.
Very true. Very true.
Yeah, just got off of teaching. Anyway, yeah, welcome everyone. We're glad that we're back with another one of these special sessions. Let's call them that way. You know, like when the Congress has a special session, and Dr. Amaral called for another special session. We called him, I should say, for another special session, since the last one was very, very successful in not only the information, but also, as you know, Angela, in the number of participants and the number of people that watched it after we had it live. Lots of information. So thank you, Dr. Amaral, and of course, Angela, take over.
Yeah, no, thank you. You're right. We've been having some great success with these, and I think the topic is also quite relevant to everyone out there. And so we're very thankful to have you back, Dr. Amaral. Thank you for joining us. As a parent, and I know Denise, as a parent and a teacher, is doubly interested in the topics we're going to be talking about, which is going back to school and all that entails, and what parents need to worry about, what teachers need to worry about. And then when it comes to vaccines, because there's so much information, misinformation, and people are, am I going to take the vaccine? Am I not? Let's see, there's so much going on out there. So we're really thankful to have you back for another session. Thank you very much.
Yeah, please. And it's especially because I just finished a course teaching it online that I do not care much for. For us to teach language at a beginning level, it is a challenge and a half. But our university is as all of the California State University system, UC systems, are all online. And most of our high schools and even elementary schools in California are online. I know that's not happening throughout most of the United States, but here, because of our numbers right now, we're online. So any light that you can shed on this, we'd appreciate it. Thank you so much.
Oh, cool. So thank you very much. And it's really a pleasure. You could call it, the ponderings of the mad Dr. Joe. And it's really it's really an honor and privilege to be able to be here with all of you. And I am going to do a little bit different because I'm going to stop after I finish school before I go to vaccines, because I don't really want to short shrift it. And but before I get started, I should share my screen. So now here comes my screen. And you can see my desktop. Incidentally, just you kind of get a sense. I do other things, but I just continuously read, and things are curated here on my laptop into different topics. So you might have kids in schools or universities or sports. But I did want to point something out as I look for my PowerPoint, that for the Portuguese community, and I only remembered it now as Denise was speaking, and I didn't pull up I couldn't find, I have the article, but I'd have to go get it online. I don't know if anybody saw it, but this weekend, the president of Portugal, Marcelo, who I happen to have the privilege of knowing pretty well, rescued two women who were in the Algarve in trouble. So cheers to the Portuguese president for doing a good thing and boosting tourism probably in Portugal.
As if we needed another reason to love him, right?
Exactly. He is so I'm very close friends with Eduardo Barroso, which many people in America know as the Sportingista. And he's a surgeon. I taught him how to do some surgery. He's taught me a lot. And so we're really good friends. And they were high school, they were childhood friends since they were little and all through their lives. And that's how I met the president, through Eduardo. So anyways, I'm going to get started. I think that today at some point this afternoon when I was putting this together, there are 5,700,000 cases of COVID-19 in the United States and 176,729 deaths. If you look at that death number, that's more than the number of people that die in a full year from breast cancer, prostate cancer, and another cancer combined. And it's double the amount of people that die from diabetes per year. So it's an extraordinary number of deaths. And I think sometimes people have a hard time capturing the fact that this is really an issue. So, as we go through this, and now we're 6 months into this, I think what I think and see is there's three basic questions that everybody asks. Should my child go to school? What's going to happen with vaccines and immunity? And when is this going to end? So I'm not going to cover that one today, but I will focus on the other two. The last one would be fairly entertaining. But anyways, so one of the things that I do, I work, I'm retired, but I'm not retired. I work half the year as the chief medical officer and scientific officer for a venture capital firm in the Midwest, and I evaluate healthcare technologies, and created the scenario plan that we use in terms of trying to decide what the world looks like during all the uncertainty. And I track it, and we track it, and we make an assessment. So, these are typical what are called Harvey Balls. So if it's solid red, that means it's really bad. If it's half red, that means it's bad, but not a 0, which would be neutral. And we'd like to see everything in green. So for June, July, and August, you see how I've sort of assessed what was going on. Back in June, the cases seemed to be okay. We were coming out of the bad situation in the Northeast. Everything seemed pretty stable, and then the cases started to rise, got really bad in July. And today they're getting better. They're down to about 40,000 per 7-day average is approaching 40,000 per a week. And, that's approaching what's going on in Europe. So we're now at about the level that Europe has risen to. Vaccines and treatments, which I will talk about today, early in June, there was a lot of optimism. In July, they started to enter into phase 3 trials, which I'll explain later, and that's where they are today. So there's no negatives there, really. That's like a half green, pretty optimistic. The economy seems to be probably going to be good. Okay, we weren't going to get really hammered back in June, got worse. The surge has definitely impacted the economy negatively. This week is the first week, actually, or the past week was the first week since the pandemic started that less than 1 million people applied for unemployment benefits. So, there's just an extraordinary number of people who are unemployed. The stimulus bill hasn't been passed. The supplemental income hasn't been passed. So there's a lot of economic distress in our company. Despite that, online industries are doing extremely well. They're all reporting record profits because nobody goes out. So Walmart, Target, Lowe's, they're all doing well. But the rest of the world is doing not so well, lots of bankruptcies. Healthcare, I would say, is a neutral. Healthcare, the surges by and large, and the cases are now controlled in the hospitals, but hospitals, for the most part, even those that shut down now are all reopened. Patients still are reticent to go to the hospital in many places. In some places, they're not. But in New York, in the Northeast, and in other places, people are afraid to go to the hospital. They prefer to have outpatient services done. And in addition to that, physicians haven't recovered. So the healthcare is not very good, but sort of rated as neutral. And then education looked pretty good back in June. Everybody figured this is going to go away. Kids are going to go to school. And it got really bad during July, and I think even worse now. And that's what I'm going to talk about today. one of the themes that I have that I think about is that during an epidemic or a pandemic, you can't count on anything. And so one of the issues I think that has happened is that everybody just assumed schools were going to open. And we didn't make good use for the most part, although some places did, with regards to preparing for the alternative of virtual education in case something had happened. So with that in mind, then, let's dive in. So there should never be any debate as to whether schools are a critical component of our society. They're a critical component. And the principal function of schools is to educate people, our children and young adults. And no one is arguing, I think, that point. And it gets lost lots of times in the debate. But education is really complicated. If we look on the left to primary and secondary education, when I went to school many years ago, a school had one purpose: to educate kids. It wasn't about great sports. It wasn't about mental health, social welfare, getting lunches, any of those things. But over time, schools have evolved and in many ways have functions of mental health, social welfare that are equal to or more important in some cases than education. And we see in the debates and discussions that go on this dynamic between these two aspects for primary and secondary education. And something that is always hard for me to understand, and actually I want to thank PALCUS because by putting this talk together, I really did understand it better, is it is an important part of economic development. And I think one of the reasons that you always, one of the reasons that you always hear put into the discussion of education is you can't open the economy if you can't open schools. And I must admit, kind of irritates me sometimes because I don't think that the two should be linked. I appreciate it better now, and I can talk to that a little bit as well. Colleges and universities are very different than primary and secondary education. Obviously, they serve a tremendous function in educating both young and non-young adults. And they also function to provide independence to young people. It's oftentimes the first time that they're living away from home. But the one thing that I think many people forget is I actually am biased, having been a professor emeritus. The most important thing that our colleges and universities do is to provide new knowledge, education, and research, which gives us the innovation and is what makes America stand out amongst all other countries. We have the best universities in the world. I think 8 of the top 10, 30 of the top 50. And they're the sources of new knowledge and information. Think of all the information that's coming out during this pandemic, and it comes from those universities. So for me, that's really important. But I think it's important to our society. They also are, have sports, and so that's an important component for those who are interested in sports, and often are the proving grounds for Major League athletics. And they too are an important source of economic development. So the first message I have related to education is, I think one of the mistakes that we've made in hindsight, it's always good when you're looking backwards, is we've looked at this as an all or none phenomena. It's black or white. You either open them or you don't. And I think that that's a bad solution. And if you look at it and prioritize the activities and the importance, you can come up with a different kind of approach. And I haven't seen what I'm going to talk about today written anywhere. It's just my synthesis. But with that in mind, I want to emphasize this concept of education and economics. I'm very sensitive to the economic aspects. I'm going to really be more focused on the educational piece of it. And how do you provide students the best education? So when we think about education, we think of a chain of people involved. And on the one hand, we have parents who help them do homework and make sure they do their homework. And we have teachers and aides. and then there's a student in the middle. But really, it takes a village of people. So to educate one student requires all these people. And so when we think about educating people during a pandemic, it's not just the student that's at risk or the parents, it's everyone that's involved in this process. College professors and college educators, they don't have to be professors, in general are in an older age group. I think the average age is like 55. Teachers also are a little bit younger, but certainly are in an older age group, and so they're at a risk. But think about the drivers of the buses and the nurses and the administrators, all these people. They're not, not a lot of young people. So that many of them fall in a high risk group. And then the child gets home, and if the parents are working, well, there's grandparents and there's siblings and there's caretakers. So there's a lot of activity here. The reason the some are in green and some are in black is because when people talk about opening the economy, those greens are all the jobs that aren't happening right now. And so I really didn't appreciate that till I made this slide. It is a huge impact. But for me, I think all these things, all these jobs for the most part, with few exceptions, can be utilized in a virtual way also of educating children. Just because a child is not in a school doesn't mean they can't have a lunch delivered to them. And in fact, many communities are doing that. So being a little bit open-minded at this time is also helpful, but I wanted to really emphasize this idea that there is a lot here at stake for governments. So it's not a question of if, it's a question of when. And it requires an understanding of the safety of children as well as the population. And that really leads to three questions that I'm going to address initially. The first is, do children get COVID? If they get it, do they really get sick? And can they spread the disease? And over the course of the last 2 months, there's been more misinformation. Well, I don't know if I should use the word misinformation. What there has been is people who just looked for the answer they wanted and spread it out there. And there's reasons why you can't fault them, but I would also say that in many cases, it wasn't very critical thinking. And I'll give you the reasons why. The response to an epidemic is a very, we're not making this up, incidentally. This is the way they're done. The first thing you do is if you have a disease that's foreign or unusual, you isolate the people and quarantine them. And basically what you're trying to do is if you get the first person who's gotten the illness and you put them in a room and nobody goes near them, it's going to die out. It won't go anywhere. Obviously, in this case, that wasn't the case. There's a lot of debate as to why. And then you institute travel quarantines. You don't want people to leave an infected area to be able to go to another area to infect more people. And we did that, and most countries did that. The timing is not for debate. What you look for then is community spread, and all of you will remember that the first documented case of community spread was in Washington, which now is actually believed to be in California, although as everything in the pandemic, it changes every day, so there's always new reports. Once you have community spread, there's certain things you do. The first thing you do is close schools. Then, and I want to introduce this term today, and I'll use it in a few places, it's non-pharmacological intervention. What's that? Social distancing, wearing masks, washing your hands, avoiding crowds, not going in crowded buildings. So that's the second thing you do. And if those two things don't control, then you shelter in place, you close down non-essential businesses. And then you monitor what's going on and you open up at certain times. So nobody made this up during this. This is the standard path that's used. And therefore, the key thing here is the first thing that closes is schools. So there's a lot of errors and judgments that have been made because, first of all, you can't compare the United States to any other country. During the past 2 months, our rates of infection have been multiples of any place else in the world, other than probably Brazil and India. But if you look in Europe, those countries were all experiencing 5, 10 cases a day, not 70,000. And so when people talk about how schools were opened, well, you're looking at two very different things. You're looking at a place that essentially has no active disease versus a place where it's blossoming. The second problem is all the data that was used was for children, and whether they spread and whether they get sick was for March and April. Well, guess what? They were home. They weren't out getting a disease. So if you look at those numbers, it's logical that those numbers are going to be low. They're not going to be high. So it led to things, people saying, well, children don't get COVID-19. And if they get COVID-19, they don't get sick. And besides that, they're, to quote somebody, they're blockers. That term actually doesn't come from a government official. It comes from a paper written in Germany. They're blockers. So the reality is children do get COVID-19. They are not immune and they do get sick and they can't transmit the disease. So since children have become more active, the rates of infection in children are increasing greater than any other age category. On August 13th, there were 409,000 reported cases in children. Children represent 22% of the population. That represents 7.5% of all the cases. That's a 7% increase from the previous week. I'm going to show you the numbers today. This number of 406,000 only represents in 49 states in this case. New York doesn't report by age. So these come from the state departments. And as you know, a lot of confusion in what numbers they give. So children 12 to 18 have had a 6-fold increase in the past month, and children 0 to 12, a 7-fold increase. They're more active, they're going to get sicker. And as you might predict, the patterns that you see are the same patterns that you see in adults. White children test positive less often, and the highest. The have had a 6-fold increase in the past 3 months in children. And I just heard myself. And so blacks 30%, black and brown children 30%, Hispanic children 46%. It's kind of like what you expect to see in the general population. If you're higher income, the incidence is lower than in the lower income groups. And these are, at the end of the day, a respiratory virus has an important environmental component related to congregation in homes. Latinos oftentimes live in multifamily dwellings. I mean, that's what happened in New York. So children are just as likely to get it. And in some places, like Wyoming, it's 16% of their infection rates are in kids. Where you have higher rates, you would expect to see higher numbers, but there's another problem here because if people aren't actually testing, many states are decreasing their testing rate, which is making it a little bit more unclear. Children get sick. So children are hospitalized at a much lower rate than adults. And that's a good thing. It's also a bad thing. The bad thing part of it is that they're more likely to be asymptomatic and you don't know they're sick. And despite the fact that they're asymptomatic or have very mild symptoms, they actually have a higher, a study published this week shows that they have a higher rate of spreading than adults even though they're asymptomatic or minimal symptoms. So the good news is that while 8 out of 100,000 children need to be hospitalized versus 164 out of 100,000 for adults, they both require the same intensive care unit. rate, 30%. So if a child is hospitalized, there's about a 30% chance he or she will end up in an intensive care unit. And in a study done in Europe of children who were hospitalized, the mortality for those children was 0.6%, which is about what one would say is the adult mortality today. Now, the overall mortality for children is probably less than 0.1%. So when somebody says, well, they don't die, well, it's your child, they died. But in general, their rate overall is less. But if you go back to the 1918 influenza, the highest percentage death was in the elderly and the very young. But they didn't get sick. There was some immunity or something they had, and nobody knows why. Imagine 100 years later, we still don't know why. The majority of people that died had a low death rate, but it was where the 20 to 40-year-olds, because there were so many of them that got sick, even with a low percentage of death, when you got sick, it ended up that was a huge number of people. So death rates in a number of people infected are important. And if you continuing to increase the number of children getting infected, more are going to get sick and more are going to die. It's just math. Again, Black and Hispanic children are more likely to be hospitalized than not. And what's a little bit scary for me is that it might look like a big number. I kind of see it as this, it might look like a small number, or it might be what you would predict. 42% of children who are hospitalized have at least one underlying condition. It's 80% for adults. And obesity, which is the #1 condition for adults, is also for children. And about 20 to 25% of children in the United States are obese. It's just a small problem. Obesity, nor this. There are, actually as of today, 106 recorded deaths, and there's more than 500 of this Kawasaki-like syndrome, which can lead to long-term heart disease. Now, there's no long-term heart disease reported so far for COVID that I know of in children. But in young adults, there's at least 12 NCAA football players who can't play this year, even if they had a season, because they developed myocarditis. Myocarditis is an inflammation of your heart, and it can be self-limited and go away. In the case of one of my late colleagues who I went to medical school with, it didn't go away. He needed a heart transplant. He lived for many years, but eventually passed away from that. So we need to remember that we don't know what happens 10, 20, 50 years from this disease. And even today, there are people who, and over the years, there's been correlations made between Alzheimer's and the great influenza, Parkinson's, and a whole host of things. Whether those things are true or not, it's not clear, because it's really hard to figure some of this stuff out.
Dr. Amaral, the teenagers that developed that can't play football, they had COVID and then developed the myocarditis, whether it was a result or it's just a correlation, but they all had COVID.
Yeah, no, but it's not a correlation. They definitely got it from the COVID. And actually, there's a Rodriguez, a baseball player with the Boston Red Sox. With the Boston Red Sox, it's happened to him as well. So remember that COVID-19 attacks the ACE2 receptors, which are blood pressure regulatory, and they're located in our blood vessels, they're located around our heart, and they're located in our lungs, they're located in a whole bunch of locations. How they get it isn't known. It could happen from inflammation in your lung, that inflammatory reaction then causing the inflammation of your heart, or it can be direct attack. That piece of it isn't known. But the relationship between, 12 high school athletes wouldn't get myocarditis if they didn't get an infection. That's a really high number. And please stop me with any questions. Mm-hmm. So, can children transmit the disease? Well, all the early studies said, no, they can't transmit the disease. Well, first of all, I looked at those studies. They're pretty poorly done. The way they did it was, if somebody in the house got COVID, they figured out who was the first person. And if it was an adult, then they just said it was an adult. Well, it turns out 40 to 50% of kids are asymptomatic and they didn't test them. So we now know, based on multiple studies, at least two, well, I should say two, that children actually have higher levels of virus in their airways and nose than adults. And in this study that was published this week, was done at the Mass General Hospital, it was really shocking because they had more virus than people that were adults in an intensive care unit. So like the sickest of the sick. Children who are aged 5 and younger who develop mild to moderate COVID-19 symptoms are 10 to 100 times, have 10 to 100 times more virus in their nose than throat than older children. And 18% of people test positive after contacting someone aged 10 to 19. That number is a little bit higher than what it would be for an adult contact. So I don't know that it's any worse than other respiratory viruses, but based on this information, children and young adults spread the disease. And we know on the young adult part that since economies have opened and there's been this rapid growth in with the biggest growth in the numbers during July were from people 20 to 40. They've been spreading the disease. And in many states, the majority of people who are hospitalized are younger, but in many of the states like Florida and Texas, it was older. I think in California, it was younger that were hospitalized, but in Texas and in Florida, actually, it was being transferred to older people. So, Mike would say they can transmit the disease, but that doesn't mean you can't open schools. You definitely can open schools. And I'm laughing here, I'm smiling because I thought I put in another slide, it's not here. The number, so on the 16th, the number was 406,000 children. Today, the number is 529,000. That's how fast it's growing. And I thought I had the slide in. And it went from 90 deaths to 106 deaths in kids less than 18 in less than a week, 6 days.
Wow.
So you can open schools safely. So again, I'm not anti-schools opening. And I think you got to open them when you don't have an epidemic going on. Everybody knows the difference between an epidemic and a pandemic. An epidemic is when a virus will grow at a rate that's uncontrolled. A pandemic is when it's growing at a rate that's uncontrolled in many countries. So we have a pandemic, but for all intents and purposes, we have an epidemic in America of COVID. And the general rules that the World Health Organization and the CDC put forward is that, actually the CDC puts 2, World Health has 3, I put all of them. So one is that the average test positivity rate is less than 5 for 14 continuous days. So the problem with the average test positivity rate is if you don't do enough tests, you can have a high rate because you're not doing enough tests. And that's the average number of tests that people want to have done is 2 per 100,000 people. And over the past 2 weeks, that number's been going down. So the state of Washington has 100% positive rate because they're only testing people who are sick. So they I don't know how they're going to open their schools. And I'm going to show you some numbers. And then the reproductive transmission rate is a factor that's calculated. It has to do with how many cases and how it's spreading. But in general, what you want is 1 or less. And it's a mathematical calculation. I couldn't do it. But you can find it on there's a website, RT Live, and it'll tell you what it is for your state. And you want to have a low number of cases per 100,000 residents. So the problem for schools is, people sort of envisioned, we're going to open schools. Everybody's going to go back. They're going to go to band practice. They're going to go play football. There's going to be interscholastic sports. Well, what happens when your community is fine in the next community is a wildfire. And that's actually happened in Missouri, where teachers went to a conference where there was essentially zero COVID. They went to a teacher conference in another city 3 hours away that had a high rate, and half of them came back or so with COVID. And there's other reasons for that. So we need to be mindful of that number. So these are the things that officials should be looking at to open schools safely. Green is you can open. Test rate's less than 5%, your transmission rate is less than 1, and you have less than 10 cases per 1,000. You're in the middle, yellow, when you're 5 to 10%, you're above 1, and you have 10 to 100 cases. And you should not open if you're above 10%, if your RT is greater than 1, and if you have more than 100 cases per 100,000 people. I'm going to prove this works in a minute. What this also means is...
I just have a question about testing. So would you recommend, so you, like, for example, up in, I think we said it was Oregon or Washington, where they're only testing people who are sick. So of course they have a high positivity rate. So, you know, us as parents or teachers, even if we're not feeling any symptoms, should we just go get tested anyway to have a more accurate test rate?
Yeah, so right. So no one has recommended mandatory, well, there's variability in different schools. Some universities have started with this idea that they were going to test everybody when they went, like Notre Dame. I'll talk about them in a little bit. Most public school systems and the CDC have not recommended that you do testing prior to entering school. I could argue that one way or the other. I don't think I'm not going to bother. Do I think it's important for teachers to go or parents to go and be tested if they feel fine? Probably not. You could be asymptomatic. It has more to do with, you know, your activities and your exposure. Like, I don't go out other than I go to Lowe's, I wear a mask, I come back, you know, so nobody comes in my house. If my friends come over, and which is like one couple, they'll sit out we'll be outside. So when you're using all those rules, your chances of a problem are low. What you need to be doing is what states need to be doing is encouraging routine testing in some sort of random manner at this point to see what the level of infection is in the community. It's not about just capturing sick people, because if they're sick, they're sick. The problem in this disease is you're not sick, but it appears you can spread. So I wouldn't necessarily go out and get a test, no. But I want to kind of focus on this because test positivity 10% is you don't open. But I want to make another point to this, because none of this is rocket science, really. It's kind of simple. If you're yellow today and you're deciding to open, that's a mistake, because you're going to go to red. It's not going to get better. It's going to get worse. And I'll show you why. So here's the good news. The good news is COVID has come down in the United States. There's only 2 states right now that have increasing numbers of cases. Maine, which went from 5 to 15 or something. Doesn't really matter. And Wyoming, which also is low, it's gone up, but the numbers are low. Florida's down to, like, I think 5,000 cases per day. Texas is on the borderline. It could be up or down. But you know, this graph is pretty dramatic. Remember, this is when everybody was like wigging out in April and in March because of New York. And this is where it was in July. So if you close schools here, why would you ever think of opening them here? It's, you know, this is not rocket science. However, here's the good news, and I have to move my thing because I can't see. It's coming down. So let's not like jump the gun like we did over here to create this. This was created by us because it was starting to come down. So I went through the list today, just to let you know. And green, you could open. So these states here, all these states have a positive rate that are below 5%. And I'll tell you that most of them are like 1 or 2%. And all these states have a testing rate above 2 per 1,000. So all these green states are doing a great job. So if you're in these, you pass that test. Now, those that are that are bolded, the percentage is going down or flat. Those that aren't bolded, it's trickling up. So if I take Rhode Island, for example, they're at about 2.5%, and it's trending up on the 14 days, but they're still quite low. So I don't really have much of an issue. I don't see a problem with opening in these schools, with opening in these particular places. I looked at their respiratory transmission rate, and it sort of correlates, right? I just said Rhode Island was going up a little bit. Well, their transmission rate is above 1. So Alaska, Colorado, Connecticut, DC, Maryland, these places, on this basis, no problem opening. But if you take an example like Massachusetts, it depends on community to community, because these numbers are aggregated for the entire state, and you have to drill down to each individual school district to make a decision. So those are the things that people are monitoring. Now, this, incidentally, is 22 states, so less than half the United States should be able to open anything. I know some of you are in California, so California's number's been going down. I think that they've been doing a great job there, outwardly looking at what's going on. And if I lived in California, I'd be proud of what was happening. People, I'm sure not everybody follows the rules, but it's gotten better. So you have these states that are yellow. So that tells me you can't open right now. But if you work hard, you're going to be able to open soon. You're between 5 and 10%. Now, I want to point something out here and focus on Florida, Georgia, Mississippi, Tennessee, and Nevada. Okay? They're going to come up later. So I'm going to just say Florida, Georgia, Mississippi, Tennessee, and Nevada. So once again, if you're bold, you're decreasing. If you're not bolded, you're either flat or increasing. So not a lot of positive activity in these states. There's 28 of them, and it doesn't look to me like anything could happen here. Very good. So principle 2 is, if you achieve these numbers, you got to keep them there. Because if you don't keep them there, you're going to end up in a mess. And so how do you do that? You follow the rules. So what it means is opening up schools is more important than opening up bars and restaurants. It's more important than going to the Sturgis motorcycle. And everybody has to do it. Because if you don't, the numbers can change unless the virus disappears. So if as a society we believe opening schools are important, which I do believe, then it's not just the kid and the parent, it's everybody. That's the real importance of this. So wash your hands, physically distance, avoid crowds, cover your face, enjoy the great outdoors, and stay in your bubble. So when schools open, it's a mess, frankly, because everybody's doing something different. There's no standard federal rule. Every governor most governors have no rules, and it ends up being decided at a local school board. So if I took 20 schools, I'd get 20 different approaches. That isn't what happened in Germany or Denmark or South Korea or any of those countries. There's one way to do it, and they did it that way. The problem to start with this is, if everybody does everything different, you can never get better because you don't know what's going wrong. You got to keep it all the same. Well, we're not doing that. And what many schools rely on is temperature checks. I'm going to tell you, of all these things, you could throw that completely out the window. It doesn't help. Most children don't get a fever to start with because 40 to 50% of them are asymptomatic. Give the kid a Tylenol and his fever will go away, or an aspirin, or whatever you give them. You should give kids Tylenol, not aspirin. So, and studies have been done that show the only value to temperature checks is they stop people from going when they have a fever. But nobody gets caught. You know, they don't normally get caught. Now, I'm sure that it's not as negative as I'm painting it, right? But that's not how we're going to prevent this with simple temperature checks or do better. Health assessment is actually pretty good. You know, you ask the kid, you get some questions, they'll tell you. Face masks, social distancing, class size less than 15, outdoor classes, and everything in bold, those are the measures that have been used around the world to control the spread in the schools.
What do you mean by staggered?
Yeah, so, right. So let's say you have first, second, third, and fourth grade. You would bring them in, like, let's say you'd have, so first, let me do high school. So in high school, you have to stagger it so that they're moving 15 minutes apart so that you don't end up with all 600 kids in the school, in the corridor. Okay, and for kids coming and going from school, you staggered the starts. In Germany, the school day was only, they had two different things, but they would only go 4 days. They'd go half the day, and then the rest of the day would be learning at home or virtual. It was really more hybrid. So there's a lot of variations. I'm not saying everything has to be the same, but in Orange County, they decided you don't need to social distance and you don't need to wear masks. Okay, well, that's your rules, but the guidelines say, social distance from the CDC and wear face masks. So I think that those things are important in preventing the spread, and whatever people use, they're going to use. But my recollection right now is that none of the schools that opened use a class size greater than 15. A lot of them use 4 to 5 student pods. They change the way they teach so that, the history teacher teaches English, so that you're with one person. Outdoor classes are a great thing. Massachusetts is planning on using them. I think Rhode Island is going to use them. That's what they did in Denmark. They had outdoor classes. Obviously, if it's raining, you can't. But, you say, well, so the way we approach this is to say, well, you can't do that. It rains. Okay, well, on the day that rains, you come inside. But if 80% of the days you're outside, you've reduced it. Now, University of Texas, El Paso has actually built a whole outdoor campus for doing education outdoors. So it could be a good thing. So when we think about opening or closing schools, what drives opening or closing schools for the full day, in my opinion, is to relieve parents of, so they can go to work or whatever it is. And I understand that's an economic burden. Either you can't work, you have to pay for daycare. I'm not belittling it. But everybody has to make some kind of sacrifices, I guess. So I can't tell you what's important. I can tell you the ones in bold are things that are important. Cleaning your school 20 times a day is not necessarily important. Having good ventilation is important. Keeping the windows open, making sure your air conditioner filters are clean. So ventilation is really important. Having really good routine testing available that gives you rapid results. Being able to do contact tracing. Those are critical. If you don't have good routine testing and you don't have adequate contact tracing and you don't have a good test rate in your community, I don't know, you shouldn't open your school, in my opinion. I'm giving you my opinion based on what I'm reading.
What should we
As far as
ask? I'm just asking because we just had an open house, virtual open house yesterday. And, that was one, the COVID actually never came up because it's all virtual right now. We're not actually going back to school. But once we do, when you say routine testing, what do you recommend as far as schools go? Like the teacher should have routine testing and what's the communication? Like as soon as somebody tests positive, the whole school is notified? Or, I know that sometimes principals don't like that because it causes panic, but yeah.
Right. So the way it's currently done is that through some mechanism, either through random testing, routine testing, through temperature checks and health assessment. So my concern is that if you're not doing routine testing, and children can be asymptomatic and they do spread, an asymptomatic child can be in the classroom, and if they're not randomly or routine tested, they're not going to get picked up. I'm not going to say that you should do, when I say routine testing, that's something people are doing. I'm not going to put you, that's sort of been the rule for universities that we're going to open. In primary and secondary ed, that's not the case. I would say if you're wearing face masks, maintaining social distancing during class, and following those rules and have good ventilation, I don't think you need to do testing of all these schools. I wouldn't be particularly concerned. But if you're in a school where you're not doing that, well, then I'd be really concerned. So it's hard to, in the ideal world, I'd have a class of 15. If I could, it was my candy store, I'd have a class of 15 or less. I'd have one teacher to teach them everything, or, maybe two. I'd only have them for 2 or 3 hours and send them home, and then continue virtually with aspects. And I'm going to talk a little bit more about virtual in a minute. But I would want them to wear face masks and social distancing. And I'm going to give one point that I'm sure everybody's going to tell me I'm wrong. My wife already did. You will too. But I actually think I'm probably right. So these are the things, and every school and the school systems in different countries have used different aspects, but in general, 60% have face masks, social distancing across all of them. They all do temperature checks and health assessment. I really hammered the temperature check. I don't want to say you shouldn't do it. I don't want people to put faith, oh, that's going to solve the problem. We're going to do temperature checks. That's not the problem solver. It's the same as it is for adults. I really like outdoor classes. If you can take the kids outdoors, that's for me the ideal. And then staggering. So I think that there's enough here that you can make it work, but I don't have an answer.
I just want to do a quick time check. We have hit the hour, and so maybe we could call maybe we could call an audible and cover vaccines in another session. Yeah. I mean, we're just always looking for excuses to call you back and have you do more of these. So as long as you're willing.
I can do it next week, and I apologize. I'm talking a lot. I feel like I'm talking to my two best friends, Angela and Denise. Just kind of quickly ending here then. What you can expect is when schools open, you're going to have outbreaks. I can finish this in about 5 minutes, I think. When they open, you're going to have outbreaks. It's just what's going to happen. And so there also needs to be a plan on how to deal with the outbreaks and what you do. What most schools do, which for me makes sense, but creates a problem that people haven't been talking about, is if somebody tests positive, then everybody who's been in contact with them and that student are quarantined for 14 days, irrespective of the test. Now I got to ask, what happens to that kid's education during that 14 days? And what happens when that kid who has to quarantine because he was in contact with them but actually doesn't have COVID comes back to school 14 days later, and another kid gets COVID who he's in contact with, and now it's got another 14 days? So I just went to the news service and pulled up some stuff. First day of school at Indiana. A kid went to school testing positive, and it happened last week in Oklahoma. Didn't know. This one didn't have the test result. The one in Oklahoma knew he was positive, but he didn't know he had a quarantine. Israel opened schools, and it's believed to have led to its most recent outbreak, but they didn't follow the rules. So you don't follow the guidelines, it's what you get. Georgia opened schools. So far, they've closed 3 high schools, 1 entire school district, and there's 1,000, at least 1,200. That was 10 days ago. Michigan's had 14 school-related outbreaks. There's thousands. Texas. Okay, so the teachers in Arizona in 1 school district, they didn't go. They can't call in sick. We're not going. Another district in Nebraska, Mississippi has 2,000 students quarantined, 500 teachers quarantined, 200 people. So the reason I emphasize Florida, Georgia, Tennessee, over 2,000 Tennessee children, none of them should have opened, according to the numbers. So this is self-imposed, if this is what we want. No matter how you do it, kids are going to get it, and you're going to have interruptions. So we need to figure out how to minimize those interruptions. So in the last couple of minutes, most colleges and universities in America are doing virtual. There, as of, this is from the Chronicle of Higher Education. It was published this week. The data is collected about 2 weeks ago by Davidson Crisis Initiative, or the College Crisis Initiative, Davidson College. At that time, 2.5% of universities were planning to do full in-person education. 24% were to be determined. The rest are either hybrid or fully online. So on the left, we know, or it's well known now and documented, that young people have been driving the growth in the past few months. And, I don't know about you, but when I was 18, 20, I was not going to be tied down. And I know parents send their kids to get educated, and kids go to college to socialize and have fun and grow up. And the idea that you're going to put them in off-campus housing and they're going to follow rules, it's kind of hard to imagine. So what happened? Notre Dame went through this extensive program. They tested everybody before they came. 99.7% were negative. And within 1 week, they had to close the school. University of North Carolina closed the school. Michigan State closed the school. There's 3 other schools that are having outbreaks. They haven't closed yet. One's Oklahoma State. One is, I can't remember right now, but there's two or three others in the news. So that's even worse, opening a school like that and closing. Because now these parents are really upset. The students are upset. The students are saying, we told you we didn't want to come. So it's creating some problems. So I want to cover just quickly some other issues, because I think maybe people will think I'm just a terrible person. First of all, I think virtual learning is actually quite good. And all studies document that if people are trained, and if you have a good program, that for older people, like in high school and college, it's as good or better, because it's more interactive individually with the teacher. People will do things at their own pace. So there's multiple studies that show that. There's no studies for young kids, and I think it's very different for young kids. But I don't believe that virtual learning is a terrible thing. It's just something we're not used to. Everybody says, well, kids don't have laptops and they don't have Wi-Fi. That's an excuse. If as a society, we can't figure out how to get laptops and Wi-Fi to all the children in America to be able to have it, we'll never be the leader in the future, because the whole world's going to be online. And Lowe's in one community just donated laptops to all the kids. I mean, that is not a reason to do it. Ann Arbor, Providence, those are two that I know. They've made sure that all the kids have laptops and Wi-Fi. Lunches and meals gets thrown in my face when I write something. Communities can provide Meals on Wheels to kids, and they have. Again, Ann Arbor, Providence, those are the communities I know. Telling me a kid has to go to school and then using that they don't get a good lunch at home is the reason that they have to go to school during a pandemic is just not trying to solve the problem. There are ways to address these. Social workers can make home visits. Somebody said to me, well, what happens if they don't Zoom? Same thing as they don't come to class. Second time, you send a truant officer. You got all these drivers looking for something to do. We can employ people. And so I think I would rather not look at like it's a terrible thing. Virtual education was terrible in the spring. Nobody was prepared for it. The teachers aren't trained, but we could do a better job. And so our children deserve to be able to go to school and be free of concern that they're going to get sick, that they're going to bring something home to their parents, or get quarantined for 14 days. And if we don't really figure this out and take a step back, that's what's going to happen. And I think that's personally worse than them being in school. So the last slide on schools is, if I were doing it, I would try to open K through 8 as soon as possible. And I would stage it. We don't have to do everything all at once. Get those kids in school, get a stable situation. And this is the one nobody will agree with. They will wear masks and they will follow the rules. Because if you tell a kid to do something in a class, he's going to do it. Now, I know teachers are going to run around. It's going to be difficult in the beginning, but they'll do it. I see kids all over the place with their parents wearing masks. They don't seem to be complaining. For secondary and high school, for the high school, I would start out virtual. You should be able to teach them. I remember my history class. I didn't need to be in it wasn't a big experience in education. And undergraduates, I think they should all start virtual. And I would do the first semester for colleges and universities because you have to travel, you have to quarantine for 14 days when you go to imagine that you live in Massachusetts and you're going to college in Connecticut. Now I got to come back to Massachusetts and now I got to quarantine for 14 days. Then I go to, how do you do this, right? And the fact of the matter is, I don't care what you say, you can't put young adults together in a room and expect that they're going to be able to that they're going to follow the rules. And what's even more interesting is if you think about colleges, they're going to go to college, they're going to spend 2 hours in classes, and what do they do with the rest, or 3 hours? What do they do the rest of the time? Sit in their dorm room? And many dorm rooms then are individuals, or they're going to be out. How do you go eat? Where do you go get lunch? Dining halls. There's a lot of stuff there. And then the last is, I think, in person for graduate students, because we need to continue to do research, create knowledge and all that. And the professors, I'd have the professors in school and the teachers in school. The teachers shouldn't be teaching from home. They should be teaching from school. So, but in those states that are good to go. Just, I wish we would stop opening up when, the percentages are, the percentage in pretty much, I think it's 19% positive in Mississippi. Okay, kids get sick. 14% or 12% in Georgia, they get sick. So, or they get the disease. So that was schools. I'm sorry, I went too slow.
No problem. It's all really important information, and I found it quite enlightening on things that I hadn't thought of before, and questions that I now know to ask the school when they say we're going to open. Denise, do you have a question?
You want to know what is there? How do you know it's safe to open? And don't accept because we're going to open because that's what they say.
Mm-hmm.
So go ahead. So Denise, you must have as an educator, you must have a good point of view on this.
Well, I'm not here to give my point of view, but You're the expert,
Well,
the health
no,
professional.
we're all experts. I'm just pushing together the information.
Yeah, we have too many experts. Trust me. As we can see, as we see through social media, there are unfortunately too many experts. Everybody's now an expert on COVID. As we used to say in Portugal, everybody was a expert on on a soccer game. Everybody was a coach. And so now everybody's an expert on COVID. It seems like. I believe you hit all excellent points, and like Angela said, lots of questions were answered for people, and lots of information for people who are concerned about their kids and to ask the questions of the school, because I think that's very important, that people are active in their kids' education. It is exactly what you said, and we just had all of these colleges that decided to open up, even some, with the measures like Notre Dame and everything else, and then all of a sudden they have to close. I think as educators, we're better off, as you mentioned, preparing ourselves for virtual teaching. It didn't happen, unfortunately, with a lot of school districts and even colleges and universities throughout the U.S. throughout the summer. And that's what we should have spent the summer on, that we were prepared for, and not say, well, everything is going to go back to normal. And so right now, let's just go ahead and open, and see what happens. And then now all of these colleges, universities, schools that you mentioned, a few of them, and there's many more, as you know, but especially in those states now, they haven't been preparing for virtual learning, remote learning. So what do? Now they close, and now they're going to have to be closed for 2 or 3 weeks as they prepare teachers who could have been prepared throughout the summer. So I'm all kudos, and I have the Fresno State who made that, and the California State University system that made that decision early on in the end of May, and said, no, we're going virtual, and spent, for example, 975 of our instructors, were trained on virtual learning throughout the summer. And so we have, and I do agree with you. I mean, I teach a beginning level, as my many people here in California know. Now that I'm retired from high school, I teach beginning level Portuguese and 2 college courses. And obviously I would prefer being, face-to-face, but some of the same activities I did face-to-face, I just finished the course 20 minutes, or actually about 10 minutes before we started. And we did all of those activities. We did everything that I normally do face-to-face, including having students working with each other, because they have Zoom has this awesome thing called, breakout rooms, where students, were sent to their corner, as I would do it physically. Students were sent with a partner to work with each other for 15 to 20 minutes. So I just think that's, somehow virtual learning has been with us, and you know that, Dr. Amaral, better than I do, and Angela as well. Virtual learning has been with us for a long time. This is probably what some colleges, universities, and schools needed to wake up, that it's kind of something that we've had.
It was interesting listening to your experience, because I do a lot of teaching, especially postgraduate teaching.
Sure.
And one of the courses one of the things I teach is presentation skills, engagement, and facilitation. And so people would say I'm a really dynamic speaker in terms of how do you engage the audience, how do you use your hands? I walk around, I'm doing all these things. I can't do that this way. But as you were speaking, I just wanted to show people, like, I can use my screen as a blackboard. I wrote thank you.
Sure.
And so I've now done a bunch of these trainings. They're not really courses, it's, training. And this works. And you have your chat rooms students can work with each other online. We have more team-based learning. So students can get on Zoom. You just need to make sure that they have the basic things. So I'm not suggesting, nor did I hear you say, that that's the future.
Sure.
I'm just trying to get to my view is that, whoa, let's slow down. Because here's what I personally don't want to have happen. I don't want to have a fall that is self-imposed misery when it's not necessary. Like the summer surge. And if I'm less worried about influenza than maybe the CDC, only because when I look at Australia, South Korea, Taiwan, Japan, they all had low influenza because of their social distancing measures and masks. I mean, the disease is spread the same way. So right now, it had very low rates in Australia, which should be their peak season because they're opposite us. I'm worried about opening schools, which is, it's bigger than opening the economy the way we did before. And if we're not careful in how we do it, we could end up with, just dragging this on longer and longer. The long shot of the vaccine, which I'll go into more detail, we'll set up another one, is other than perhaps some very select group of people, it's kind of hard to imagine you would ever see a vaccine before the first quarter of January 2021, based on the FDA guidelines of what will be required. And then you got to distribute it, and I'll go through all that detail. So, if anybody has any questions, they can email me. It is really important, though, I think, for parents to be actively engaged in the conversation with the schools. Mm-hmm. They're your children. They're not the school's children. And that's the end of the day. That's your choice.
I do have one quick question, because some of the data that you showed us, especially when it comes to reopening schools in other countries, have been, some with success, more success than others, including some of those ideas that you showed, from outdoor to staggering to limiting class sizes and all this kind of stuff. But as you mentioned, in some of these countries, the education system is done at a national basis. There is a Department of Education that actually is a national Department of Education. We have one too, but it has very little influence at a state or local level. However, because we are, as you pointed out, in a pandemic, and because of the numbers that were different from state to state, correct? But it showed that it is a national problem. It is not just a regional problem. It's not an East Coast problem or a Southern problem or a Northern problem. It's a national problem. Wouldn't it have been better for us, and wouldn't it still be better for us, because the pandemic is still with us, to have some basic national guidelines that would be basic for all schools, for all universities, for all colleges, independently where they are and independently where the numbers are? Because as you mentioned, if you're at these numbers, well, open up, but open up with this and that. There aren't, other than what the CDC recommends, but through the Department of Education, I think that, sometimes we do, I think we have pride, and as we should, in our school system not being nationalized, because that's a good thing when you have, school districts, have local control. But during a pandemic, there has to be, I believe, a little bit more of a national say, because what you do in California can have some correlation, can have some repercussions in Nevada and Oregon and Arizona, et cetera.
Yeah, and no, I think you should make a perfect point. And I think that, the way I would suggest what you just said is that, and I presume, I'm making a presumption that the guidelines written by the CDC are written in conjunction with members of the Department of Education. What happens is, we really do have rules. I mean, if you follow the rules, and if you have those guidelines as guidelines and everybody follows them, then it would be okay. The problem, and we're a federation of states, we're a republic, we're not a unified country, and in some ways it's no different in Europe, because every country in Europe is different, and there are countries that haven't done well, and there are countries that have. And as you point out, each individual community is different, even within, if what you're doing, I don't know, how you're going to educate children in an inner city is going to be different than in the suburbs of, I don't know, whatever, Palm Beach. I don't know, I'm trying to think of two extreme places. So, but I agree with you. I think the problem is people don't follow them. So
Yeah.
you know, and I'm not picking on Long Beach, but it just happened to be like something that really irritated me because I don't know anybody there. But the person who ran the school committee said, well, the CDC, they're just guidelines. It doesn't mean we have to follow them. So we're not going to do masks and we're not going to do social distancing.
Yeah, it seems like if there's no money tied to it, we're going to do whatever we want to.
Right. And there, so, but on the other hand, I agree with you because I don't think we've been strong enough in any of these things and having a federal, platform. I mean, I would have shut down. I would say, you want to open schools? Great. Let's go. Let's shut down for 2 weeks. We're going to get this thing down. And everybody's going to but it's human behavior. And so I don't think that what we're doing now is any different than happened in any other period of time. We shouldn't think we're different. During the influenza, they opened up some schools in New York and Chicago, and the results weren't that great. New York actually did pretty good, but New York actually never got really hit bad either. They think there was a lot of immunity because the shifts were coming in. So in any event, I do agree with you. I think there are standards. Anthony Fauci, Dr. Fauci those are from him. The green, red, and yellow came directly from his mouth. The measures inside. So my big deal is, and it's a problem for parents, but it's also a problem for kids. I don't think we're paying attention to the kid in this. Quarantining for 14 days can't be fun.
Sure.
I mean, that means you're supposed to be in your house for 14 days. Mm. And then I think it means the parents have to be in for 14 days too. Because now you've got a chain of contacts.
Right.
So anyways, it's all going to work out. It's all going to be fine. I think there are going to be a lot of schools that are going to open up and they're going to do it well. And they're going to have good results. And gradually things will get better. If you had the rules in place, maybe you would do social distancing and no masks and see if you have a problem. And then if you have a problem, you add the masks. But you got to start with, you can't have active disease in your community. Right. That's just sort of a non-starter.
Right. Well, on that note,
thank you.
Thank you again.
So much.
This was great. Discussion, really great information, and we'll set up another one for the vaccines. And I think we have like a whole bunch of topics related to COVID that we're going to cover in a series of these. So we'll make we'll tag you on Facebook so people know how to reach you and send you questions and things like that. Because you publish some great daily posts when Facebook doesn't remove them, I will say.
That was so funny. Thanks for reading that. I was so upset. And I didn't even write it. They like what I write, apparently. It's when I take the head. No, I think it might have been the number. Somebody told me this and so I never write more than 1,200 words. I always try to keep it less than that. But the headlines can be 1,600 words. They're just headlines. So I just put them up there. Yeah. And so I'm actually, because I look through the headlines, there's nothing offensive. There's nothing wrong in them because I'm very careful. They tell the story anyways, but it was pretty funny. So my poor daughter, I sicked her on Facebook to get my post back up. She's like, why do I have to do it? Why do I have to do it? I said you did. No. I'm trying to put this all together into a book. And so my daughter Courtney is really helping. She's like, there's all sorts of stuff she's doing because she's temporarily out of work. So she works with Dad now. It's great. I love it. She does she's very good.
There you go.
And she's teaching me some new social media. I mean, how to do she said, what do you use when you're doing interactive work with other people? And I said, a piece of paper and pen. So it's just this stuff I don't know. But anyways, I think it's positive. We should think about schools positively. We should think that we can do better with virtual learning if that's what's necessary. And I think when you give people an answer, even if they don't like it, when you have resolution, it's better than we're going to open this week, we're going to open next week, we're going to close, we're going to do this. Sure. So I'm kind of like, look at you, Denise. You're teaching these kids Portuguese, these young adults Portuguese. They're going to learn. Go
I
outside.
hope so.
Here's what I want you to do.
hope so.
Find a figueira, and take your class outside under the figueira and give them their lesson.
There you go. Oh yes, the figueira
like
is
that.
perfect for that. Yes, yes, and
You-
I like
and I could have all the figs because I love them, and they're healthy for you,
can-
correct?
Exactly. You can be like Hippocrates. Hippocrates, the sort of father of medicine, used to teach
right.
people under a bouty tree.
Yeah.
So you can do that. All right. Thank you.
Thank you
Excellent.
so much.
Send me a
Thank you.
date.
Thank you, everybody.
Thank you.
Thanks, everybody out there,
Appreciate
for
it.
watching. Until next time.
Take
Take
thanks.
care.
Bye
Take
bye.
care. Thanks. Bye-bye.
Take care.
Bye bye.